Hi guys, today we will talk about Afro-American rhinoplasty surgeries. In this picture you can see very typically Afro-American nose before. This is very typically very deep radix and droppy nose tip and short projections and white alar flare. Depends on these problems, nose looking too much flat, and generally these patients are unhappy about these situations also too, and also depends on this bone backside positions. This is premaxillary bone we call about here. Here is looking too much backside positions mid-face. That is why at the surgery we use some grafts in here for more prominently maxillary, premaxillary bone for and more projections also too. Here is illustrations about this surgery. As we know, nose has a three different part: bony part, middle cartilaginous and lower cartilaginous part. And facial aesthetics is differently person to person and patients. Some facial proportions you can see here, some ideal angle and facial proportions, but this is differently depends on different culture and different ethnicity. And for a successful surgery we have some aims. These are symmetrically both sides of nose and also better eyebrow, nose tip aesthetic lines, and these aesthetic lines should be double parenthesis shapes and straight. Male and female nose aesthetic is differently more masculine for male and more feminine for female nose, accepted better. And here is you can see differently projections. This is ideal projections, this is long projections, this is short projections. Generally Afro-American patients has short projections, and our main aim for this surgery increase these projections also to there is some distance differently. You can see this is ideal projections and nose projections, and other part of face, nose, alar wings has some ideal ratio. This ratio depends on forehead positions, chin tip positions, and alar flare and premaxillary bone and chin tip positions. In here you can see closed rhinoplasty surgery without any skin incisions in here. We can do closed rhinoplasty techniques. Somebody else called about this surgery endonasal surgery, and this is an external surgery and open technique also too. Indeed we can do same maneuvers and manipulations, both techniques. Only unique differences is in this area we call about here is a columellar region with incisions, and without these incisions inside of nose, crescent shape incisions enter the nose. Unique differences of open and closed technique is this one. Here is a patients operated ethnic rhinoplasty surgery, Afro-American rhinoplasty, same as previously patients, very deep radix, short projections and white alar flare and backside positions, premaxillary bone, fill premaxillary bone with some dicet cartilage graft and fill radix region. You can compare with this area differences and increase projections from here to from here. And after the alar base plasty results, this is 7 days after the surgery. This is front view of these patients. You can see in here deep radix before and after changes, and white nose side walls and white alar flare, and after alar base plasty more narrow alar flare and more natural nose ridge. We try to achieve this 3/4 view after alar-based plasty results. After the hair transplantations, 3 days later, averagely we can do this surgery also too, because of we are interested in international rhinoplasty surgeries, and a lot of part of my patients come to here for combined operations, most of them hair transplantations, and after the rhinoplasty they think about, and I suggest to these patients firstly hair transplantations, and averagely 3 or 4 days after the hair transplantation surgery rhinoplasty would be a good idea for them. But if you think about dental treatments after the rhinoplasty, 6 days or 1 week later, any dental treatments would be a good idea for you also too. This is a base view of these patients. I operate these patients with open technique. You can see in here open technique incision lines and alar-based plasty 5 days after the surgery. This is also other patients, very flat nose, very deep radix and very white nose side walls after the open rhinoplasty techniques results. You can see 3/4 view, very deep radix, compare in here also too, and after increased projections and alar-based plasty results. This is also base view 7 days after the procedures after alar-based plasty. Early results you can see in here, and after the open technique ethnic rhinoplasty surgeries results, more projected nose tip, more refinement nose tip. You can see differences. Indeed, Afro-American patients main problem is very short projections. Depends on these short projections, nose looking too much flat, and when we increase this distance, we call about here is a projections in here from here. This would be more beautiful results, and main aim of this surgery is more projected nose tip and more narrow alar flare and fill radix region like in here also too. This is also another patient's front view and helicopter view. And also this is a closed ethnic rhinoplasty patients. I didn't cut this part of my patient's skin. I did this surgery with closed techniques. You can see there is not any incision lines like previously patients, and also after the alar-based plasty 2 weeks later results. You can see this is also alar-based plasty illustrations. We can do this surgery when patient's nostrils is big or alar wings is too much wide. We can remove some skin tissue in here and use some stitch and achieve more narrow nostrils and alar wings, and mostly maybe almost all Afro-American rhinoplasty patients I need to do alar-based plasty also too. This is also alar-based plasty operation table results. You can see some stitch lines before and after results. This is also male patients 6 days later, and also 3/4 view differences. Please notice the radix region after filling radix region results. This is also base view. This is also I operated these patients with closed technique also too. Alar-plasty incision lines 6 days later. You can see very unnoticeable. You can compare with helicopter view changes, too much narrow nose side wall, and after the surgery more narrow nose side wall and more refinement nose tip. And please compare with radix region from here with different angle. This is also revision Afro-American Rhinoplasty results. She operated 2 years previously and also didn't perform any alar-based plasty. I also perform alar-based plasty and increase her rotation more and use cap graft in here for more refinement nose tip and also fill radix and nose ridge region, rib cartilage harvesting grafts. This is also base view after alar-based plasty results. You can see this is also alar-based plasty and revision open rhinoplasty techniques. This is another patient's primary rhinoplasty with closed techniques after the surgery. Operation table results: more projected nose tip, more narrow alar flare, and after filling radix and nose ridge region, we try to achieve more feminine and natural results. This is also previously patients operation table videos also too. Today I wanna try to give for you some information generally about Afro-American ethnic rhinoplasty surgeries, but if you are interested in other ethnic rhinoplasty surgeries, you can find out on my YouTube channel, Asian and Indian ethnic rhinoplasty point of view, my opinion and my results also too. Thanks for your attention.